When activated, Colorflow Doppler assigns colors to blood flow moving towards or away from the transducer. The transducer is located at the top of the ultrasound screen. The standard color flow map uses the BART system, where movement away from the transducer or down is shown as blue, and movement towards the transducer or up is shown as red. BART, blue away, red towards. It is possible to reverse these colors, but we do not want to do that. The best color flow requires low-frequency transducers. Most ultrasound machines automatically default to the lowest available frequency when the color flow function is activated. The two-dimensional image degrades and frame rate decreases. A color flow box appears on the ultrasound screen. Use the trackball or touchpad to move the color flow box around the screen and place it over the area of interest. A color flow icon appears on the upper left or right side of your ultrasound screen. The icon shows that upward movement is red and downward movement is blue. The icon also shows the current Nyquist limit as a number in centimeters per second at the top of the red bar and the bottom of the blue bar. Color flow indicates direction of blood flow. It does not indicate arterial or venous flow. Your knowledge of anatomy helps you decide whether you are seeing arteries or veins. In the kidneys, red flow toward the transducer indicates the renal arteries bringing blood to the kidney. Blue flow away from the kidney indicates renal veins taking blood away from the kidney. However, in the liver, hepatic arteries are usually too small to see. Red flow toward the transducer indicates the intrahepatic portal veins, bringing 75% of the blood flow to the liver. Blue flow away from the transducer indicates the hepatic veins, taking blood out of the liver to the caudal vena cava. In many smaller ultrasound machines, activation of Colorflow Doppler diverts computer capacity to the color flow function, and the frame rate of the live image decreases. You may notice that it takes a few frames for color to register, especially if the patient moves. If a blood vessel is perpendicular to the transducer, blood flow is not moving towards or away from the transducer, and no color will show in the vessel. In the liver, hepatic bile ducts and the common bile duct can be seen if they are dilated, but will not show color. With most ultrasound machines, the touchpad or trackball is used to move the color flow box to the point of interest. Most ultrasound machines allow you to change the size and shape of the color flow box to suit your needs. In many machines, when color flow is activated, pressing the Set or Select button allows the trackball or touchpad to increase or decrease the size and shape of the Colorflow box. Side-to-side movements of the trackball or touchpad increase or decrease width of the Colorflow box. Up or down movements of the trackball or touchpad increase or decrease the height of the Colorflow box. When you're satisfied with the size and shape of the Colorflow box, press the Set or Select button again to maintain the adjusted Colorflow box size and shape. Most ultrasound machines have a knob or toggle that allows you to increase or decrease Doppler gain. When gain is too high, color speckling occurs in fluid and tissue areas. The speckling will disappear when Doppler gain is decreased. Ideally, we would like Colorflow Doppler to show pure blue for blood flow away from the transducer and pure red for blood flow toward the transducer. The Nyquist limit is the flow velocity at which aliasing or wraparound occurs. In Colorflow Doppler, aliasing is a change of colors indicating flow exceeding the Nyquist limit. Colors in the blood vessels of the abdomen may show a mixture of blue and white or red, yellow, and green. We can increase or decrease the PRF or scale to increase or decrease the Nyquist limit to try to match the blood flow velocity in the vessels we are studying. PRF is pulse repetition frequency, or the number of sound waves sent out by the transducer per second. Increasing the PRF or scale raises the Nyquist limit. Decreasing the PRF or scale lowers the Nyquist limit. Colorflow Doppler is a function of transducer frequency, depth, and computer capacity. The higher the frequency, the more limited the color flow capability. As you increase depth, Doppler capability decreases. In the abdomen, we prefer higher frequency transducers that give a more detailed two-dimensional image. Colorflow Doppler tends to work best in the near field or at shallow depths. As you push the Colorflow box to deeper depths, you may lose color flow. If color flow is important, you may want to switch to a lower frequency transducer or use transducer pressure to press the transducer closer to the vessel of interest.